The COVID-19 pandemic exposed a crisis in childcare in the North Country and across New York. And the state acted in response. It's invested billions of dollars to try to grow a childcare system for what working families need. Some of those programs have been successes, but childcare providers say one important program has bogged them down in red tape and a myriad of difficulties. The problems behind the Child Care Desert Grant on today's story of the day.
Support for Story of the Day is provided by Renew Architecture and Design, designing camps, custom homes, and more throughout NCPR's listening region. Details at renewarchitecture.com.
Hey, I'm David Sommerstein. It's Tuesday, August 22nd. First up, the State Attorney General's office is investigating the company New York City hired to manage its migrant crisis. Some migrants have reported being deceived and silenced by DocGo. DocGo received a $432 million contract from Mayor Eric Adams' administration to care for more than 100,000 migrants who have strained New York City's services. Busloads of asylum seekers were sent to upstate communities starting in May. Some of those places sued and declared states of emergency to halt the relocations. In the capital region, DocGo representatives have attempted to prevent some migrants from speaking with public radio station WAMC. Attorney General Tish James sent a letter to DocGo seeking more information on Monday. The development was first reported by the New York Times. The company says it's worked in a transparent manner and will provide James's office with any relevant information. New York State's Child Care Deserts Grant put $100 million towards helping providers open new daycares and centers where they're needed most. Hundreds have opened as a result. But the program has drawn the ire of providers and child care professionals. They say the grant has been riddled with red tape, unreasonable expectations, and no one to turn to for help. Amy Feiereisel has this special investigative report.
Christina McCarthy is 38 and lives in Brazier Falls, a town of just under 700 in St. Lawrence County. It's the definition of a child care desert. A year ago, there were no child care providers within a 20-mile radius. So the state's new program, the Child Care Deserts Grant, seemed perfect for McCarthy. She opened a center, Tri-Town Kids, last November.
We sit on 3 acres of land. We are surrounded by corn. That's, the joke is knee-high by the 4th of July, and we were pretty close to that.
The center is a big gray building that needed a lot of renovation. Down a roomy hallway lined with wooden cubbies is the infant room. It used to be a walk-in cooler.
So this is our infant room. And this is one of our little guys.
Hi there.
Miss Cassandra, one of our new teachers. Wow. But yeah, this space is completely brand new. So this was gutted to the studs from the floor up.
McCarthy employs 10 people, and there are currently 35 kids in care here, with capacity for more. In many ways, McCarthy should be the poster child of success for the Child Care Deserts program, but she says it's been a struggle from the beginning. The first hurdle was just getting open on time. To get the grant money, McCarthy had to open in 120 days.
So that was being completely licensed. That was your building completely inspected. 13 inspections from fire, from water, from electrical, from your certificate of occupancy, the state inspection from your licensor. There's so many.
They had to pay out of pocket for all that, and if they missed the deadline, no money. The state department that runs the program, the Office of Children and Family Services, defended the 120-day timeline, saying it was stated in the grant application. And according to OCFS, 540 child care providers successfully opened programs. That includes McCarthy and her husband. They did open in 118 days. But other providers didn't, like a woman who wanted to open a center in Western New York and got a Deserts Grant. She asked not to be named because she still works in the child care industry.
Even when we were awarded, there were still so many unknowns, and there was no one to ask.
She says that made it impossible to meet the 120-day deadline, and so she didn't open her center. She says it broke her heart, and it got worse when the only nearby childcare center closed earlier this year.
45 families just lost their childcare in the same town that my center was supposed to be in, and I had 73 kids ready to go.
Now, to be fair, both McCarthy and the provider in Western New York were first-timers. They'd never opened a center before. But childcare experts also say the 120-day limit is unrealistic, particularly for new providers. They'd normally suggest 6 months to 2 years to open a center.
They're in a catch-22. There was no way to be successful.
That's Jamie Basilier. She directs the Child Care Resource and Referral Agency in Clinton and Franklin counties. 9 providers in her area got Deserts grants. 7 actually opened. She says if opening was a huge lift, the next step was almost harder. Operating under the Deserts grants rules, which she says are so strict they don't work for providers.
Unless they never needed the money in the first place and had lots of money and cash flow.
This gets at what every director and provider I spoke with said was the problem with the Deserts grant, that it was extraordinarily restrictive and even punitive. One of the providers Basilier worked with had a licensing infraction early on. Timesheets weren't transposed onto a specific state form. She says the state penalized that provider by docking her grant payments by $46,000. Just talking about the situation nearly brings her to tears.
That's just wrong. I know about grant compliance. It's the story of my life. And there were records. There were employment records on file. They just weren't on the right form. So we're gonna dock an entire payment.
Childcare providers are largely low or middle income women. They work in an industry with paper-thin profit margins. But Basilier says there was little grace in the Deserts grant if a new provider made a mistake.
This woman is an entrepreneur. She is a sole proprietor. She did this on her own. This is on her nickel.
Another huge money complaint of how the grant is being run has to do with staffing. Providers are required to staff to capacity, not attendance. Here's what that means. If you have the capacity for 10 infants, but 3 babies in the room, you still have to have enough staff for 10 infants. That's the exact scenario Jennifer Lamena faced, and she says she doesn't understand it.
It's almost like they don't trust us to make business decisions. And we've already put so much on the line to open up a business and run a business. So I feel like they're taking that part away from us.
Lamena isn't a new provider. She runs 7 childcare programs down in Long Island, but she's still struggling with the Deserts grant, which she opened 3 new childcare programs through. She says staffing to capacity would bankrupt her. You can't pay 5 people on 3 infants' tuition. It's actually cheaper to forfeit part of her grant payment than to pay workers to do nothing.
It put a hardship on me because tuition wasn't enough to pay 5 people. I relied on that grant and I lost 25% of my payment.
It's important to note that the Deserts grant is not the only childcare initiative being run by the state. It's one of over a dozen. And childcare experts say other programs have been really impactful and much less restrictive. The Deserts grant is different, says Lamena. She says anyone who's ever worked in childcare would see that some of the grant requirements are akin to financial suicide.
My biggest qualm is do they have any providers sitting in those meetings when they're deciding on how we should utilize this funding?
I spent about a month trying to talk to someone from the Office of Children and Family Services, which runs the Deserts grant. Eventually, they answered in a written statement. It said that OCFS worked, quote, closely with each program by providing technical assistance, extensive resources, and training materials to all providers who sought help, end quote. But that's not what any of the directors or providers I spoke with said. Here's the woman from Western New York.
So you'd email and it'd sit in the inbox for weeks. So then you try calling and there was no one to call. There was no number.
Christina McCarthy says she had a similar experience.
We couldn't get answers on certain requirements that were needing to be submitted within that time. That was so varying from area to area.
The Deserts program has expanded capacity. It has reimbursed hundreds of providers for startup costs. But for many, including those who opened their doors, like McCarthy in Brazier Falls and Lamena on Long Island, it's been demoralizing and even a financial drain. And then there's the potential providers, like the woman in Western New York, who might not try again.
It was not what it was advertised to be. And this could have been a program that really helped our communities. And it did not. And instead, it brought on insane levels of stress to people who we already know have entirely too high of burnout levels.
She says there must have been a better way. Amy Feiereisel, North Country Public Radio.
You can find the full story online with additional interviews and context at ncpr.org. We have more news there all the time. Of course, ncpr.org. Music today by Eddie Lawrence of Moira and Caretaker of Canton. I'm David Summerstein, North Country Public Radio.